Representatives from 129 organizations are now in Trinidad for Carpha's second Joint Regional Health Security and Regional Coordinating Mechanism for Health Security meeting, as health stakeholders are on high alert amid the resurgence of Ebola and hantavirus in other jurisdictions.
Recent years have shown us that health emergencies affect more than health. They impact economies, education, tourism, trade, and national security. The Caribbean continues to face multiple pressures. Globally, concerns such as Ebola outbreaks, emerging infectious diseases, and health impacts of climate change highlight the importance of preparedness and resilience.
Stakeholders have convened with a view to building and strengthening an integrated preparedness and response mechanism.
48 hours after the recent hantavirus outbreak on a cruise liner impacted a few of our citizens, we were able to reference the Caribbean's cruise vessel surveillance system as an example of the work that can be done to improve readiness and preparedness for this type of an outbreak. Similarly, 72 hours after the activation of the most recent Ebola outbreak affecting Central and East Africa, the Tourism Health Information System was highlighted as a potential detection mechanism for monitoring travel health in these evolving times. These are concrete examples of Carpha's innovation, resourcefulness, and impact, but most importantly, of their partnership.
But Ebola and hantavirus are just two of the health challenges facing regional communities.
During 2025 and the first quarter of 2026, the Caribbean experienced over 20 outbreaks in 11 countries, including dengue, chikungunya, malaria, lepto, noro, salmonella, measles, scarlet fever, influenza, hand and foot and mouth diseases occurring in local and community settings. And in tourism settings, 3 noro outbreaks occurring in hotels and accommodations, and 50 cruise ship alerts occurring in the cruise ship setting. Additionally, priority diseases, including malaria and TB and lepto, were reported across the region.
Health Minister Dr. Lakram Bodo is giving TNT's commitment to supporting the move to a full One Health approach.
Historically, we have often measured success by how effectively we respond to crises. Today, we must also measure success by how effectively we prevent them. This requires investment in surveillance systems that identify unusual patterns early. It requires modern laboratory networks capable of rapidly detecting emerging pathogens. It requires a trained and resilient workforce. It also requires stronger data systems and information sharing mechanisms, and increasingly it underscores the need for embracing a One Health approach.
In this regard, the Pandemic Fund continues to provide financial support to small developing states.
We currently have 6 projects in the Caribbean, 3 country-level projects in Guyana, Suriname, and Trinidad and Tobago, 1 multi-country project focused on the Eastern Caribbean, and 2 regional entity projects, one led by Carpha and the other led by the Inter-American Institute for Cooperation on Agriculture, IICA. Together, these investments have helped mobilize over $590 million for pandemic prevention, preparedness, and response in the Caribbean region.
Renessa Cutting, TV6 News.